My name is Jim Smith, and I'm a nurse with the care management team at Michigan Medicine. In this video, we will talk about things you can do before surgery that will help with your recovery. We will also talk about your recovery in the hospital and explain your options for care after discharge from the hospital. Our goal is to safely discharge you home. Research has shown that patients do better and have fewer complications and readmissions when they go home. A small group of patients may benefit from a stay at a skilled nursing facility. You will have a nurse case manager that works with you and the medical team to help determine what you will need at discharge to ensure a safe recovery. Preparing a safe recovery starts before surgery. In the next few slides, we will discuss some of the things you can do before surgery that will be very helpful in your recovery. These include preparing your body to be as strong as possible, avoid drinking alcohol and smoking, preparing mentally and spiritually, find your personal support person and getting your home ready, and preparing a list of your current medications to bring to the hospital on the day of your surgery. It's also a good idea to start preparing your discharge plans. We will talk about this at the second half of this video. Being as strong as you can be going into surgery may help you recover more quickly. Talk with your doctor about the best ways to increase your strength and endurance before surgery. Be physically active and choose healthy foods such as fruits, vegetables, and lean, high-protein foods. Eating balanced meals will keep your bowel movements regular, which is helpful before and after surgery. The period before surgery can be stressful. It's important to get good sleep and find things that help you to relax and reduce stress. For example, talking to a friend, listening to music, drawing or coloring, laughing, and exercise. Other tools like guided imagery, mindful breathing, and gratitude journaling can also help you create a positive mindset. Identify what works best for you before surgery and use these tools throughout your recovery too. To help you prepare mentally for your surgery, ask questions and understand what is happening next in your role throughout the recovery process. Talk with your care team about your expectations and find out what the care team is expecting your recovery to look like. Consider your religious and cultural beliefs and how they may take a role in your recovery. Know that recovery takes perseverance, teamwork, and patience. A support person is someone you can count on to help you with your recovery, both in the hospital and when you return home. We encourage you to pick a good friend or family member to be your personal support person. They would need to be available in the hospital, preferably at the time of discharge, so they can listen to your discharge instructions and drive you home. They would also need to be available during the first days you're at home. They can help you get dressed and prepare meals. If both of you are comfortable, they can also help with other tasks, such as monitoring your temperature, blood pressure, and heart rate, and assisting you with your medications and with daily activities and exercise. After surgery, you may notice a difference in your physical abilities, and it may be more difficult to move around and get to the different parts of your home. Think about small changes that make it easier to navigate and move in your space. Decluttering is a very good idea. Temporarily remove rugs and other items on the floor that may become obstacles. This will help to prevent slips, trips, and falls. Clear the path to doors and corridors and place nightlights. Consider using a room on the first floor as your bedroom for the recovery period. In the living room, you might need to adjust your chair and use armrests. Depending on your surgery, you might need equipment to help you with showering, going to the bathroom, or to prevent falling on slippery surfaces. Discuss this with your care team. Think about how you will access your home from the outside and if you need to install handrails or another device to help you get over the stairs. Your recovery will start in the hospital right after surgery. With surgeon approval, it's important to begin walking within 4 hours of getting to your inpatient hospital bed after surgery. This helps to prevent weakening, which can happen quickly after surgery. This will also help decrease the risk of blood clots and other complications. Unfortunately, some level of pain is normal after surgery. Your care team will work with you to keep your pain at a tolerable level. After surgery, many services are available to help patients return home as quickly and as safely as possible. Your nurse care manager will work with you and your care team to decide which of these options is best for you. Specific services will be referred based on your clinical needs, your location, and your insurance coverage. We may make referrals to services you can receive at home, or we might refer you to a skilled nursing facility. Services that allow you to return home immediately from the hospital include patient monitoring at home kits and home health care. If you qualify for a patient monitoring at home kit, it will include tablets with cellular services used for video visits with nursing and post-acute care medical providers if needed, oxygen saturation monitors used to measure the amount of oxygen in blood cells, blood glucose monitors used for measuring blood sugar levels, scales used for measuring body weight, heart rate and blood pressure monitors, and thermometers for monitoring for fevers. The kit can help provide information to your healthcare team in real time. Home care programs provide skilled nursing care, home health aides, and home physical or occupational therapy sessions. Michigan Medicine has its own home care program called Michigan Visiting Nurses that can provide services in certain geographic areas. Our nurses work closely with your surgeon and other physicians and communicate with them through our shared electronic medical record system. If you need a medical evaluation in your home, we can recommend a house calls nurse practitioner to see you in your home. We provide nurse practitioner visits in Washtenaw County and Belleville as part of the home care services. To learn more about Michigan Visiting Nurses, visit the website homecare.med.umich.edu. Click on the link to Michigan Visiting Nurses. If you've used another home health agency in the past, or you have a preferred agency, we can refer you to them. Ratings for home care programs can be found at the website medicare.gov. Patients who are unable to return directly home following surgery may go to a skilled nursing facility, also known as an SNF. SNFs are also referred to as rehabilitation or a rehab facility. Usually patients stay at an SNF between 10 and 14 days, but it's different for each patient. The COVID-19 pandemic led to significant changes in the environment of skilled nursing facilities. During the pandemic, there have been times when patients were not allowed to have visitors. If direct interaction with your family and friends is a priority for you, staying home with support may be a better option for you. Your medical insurance may cover your stay at an SNF if you have certain specific medical needs. To ensure your stay at an SNF will be paid for, call your insurance company and ask them, will they cover a stay in a skilled nursing facility, and if so, for how long? Also ask if they cover the particular facility you're planning to use. If not, ask them which facilities in your area they will cover. After you select the skilled nursing facility that you want to use, the Michigan Medicine Care Management Team will help to determine whether the facility has openings and can facilitate placement. You should also find out information about the specific facility. Call them and ask, what rehab services do you provide? Do you have a gym available? Are doctors seeing patients in person or virtually? Your primary care doctor will not be able to follow you during a stay at an SNF. Michigan Medicine doctors work at 4 local facilities: Regency at Bluffs Park, Optalis Health and Rehabilitation, Ann Arbor, Glacier Hills, and the Evangelical Homes of Michigan in Saline. Other facilities may work with your primary care doctor. During the COVID-19 pandemic, you should also ask what safety precautions the facility has in place to protect patients and prevent infections. You can find out how many cases of COVID-19 a specific facility had at the website michigan.gov/coronavirus/. To see the data, scroll down to the bottom of the page and click on See Cumulative Data. On the next page, click on the link to long-term care facilities. It's also important to check the safety rating of the SNF you're planning to use. This information is available at the website medicare.gov. On the Medicare homepage, click on Find Care. On the next page, click on Nursing Homes. This will open the search page where you type in your location to begin your search. Your care team will also ask you to complete a pre-surgical checklist online. You'll receive a link to the checklist in a message via your patient portal. Your responses will help us to understand your needs and plan your post-discharge care. As I said, the goal is for you to return home. If you feel you will be unable to return home, please discuss concerns with your medical team. We hope this video helped you understand your options for after-surgery care. If you have additional questions, please call your healthcare provider.